We're 2 days into 2013, and so how are those resolutions working out for you? If you're like me, you're probably thinking, who starts a resolution in the middle of the week? Do it on a Monday, get a fresh start, right? How many of you think a Monday is just a better day to be starting a resolution? Yeah, okay. Well, our guests today say stop putting things off. The best time to make a change is now. So it's a new year, so why not take advantage of a new beginning? One of the top resolutions is to lose weight, but that's easier said than done for most of us. And for many people, losing weight is not about vanity, but about quality of life. Here to help us shed the pounds when your health is at risk, please welcome bariatric surgeon and author of Skinny Jeans at Last, Dr. Clifton Thomas, along with his patient, Katie Collier. Good morning. Dr. Thomas, we do have this obsession with weight in this country, but oftentimes people say, I just want to be skinny, I want to be thin, and it is about vanity. But what we're looking at in this nation is not about vanity, it's about lives at risk.
That's right. When people lose all these extra pounds, they really become the person they really are inside. But the way they become that is they become healthy. When you feel healthy, you feel like yourself.
Yeah. We know that the rate of type 2 diabetes, for example, is just crazy in this country, a big threat to us. And so when you can lose those pounds, oftentimes that type 2 diabetes goes away.
Usually we get people off medication for diabetes the night of surgery. And that's because of these massive chemical changes that tricks the body. And glucose metabolism changes the night of surgery. It's amazing.
Yeah, we're going to talk about the types of surgery in just a minute and the fact that many of those surgeries are covered by insurance. But first I want to talk to you, Katie, because you're a perfect example of someone who, at a very young age, you could see a glimpse into your future, what was coming. What were you dealing with?
At 24, I was diagnosed with hypertension, and so my blood pressure was getting so high, affecting my vision and things like that, which was directly related to my being overweight, and family history of diabetes and things like that, and so I had to make a change and do something.
Wait, we just saw that picture pop up. I want to look at this picture again. This is you before, and Dr. Thomas, when she says at 24 diagnosed with hypertension and some other things, that's young, isn't it? It used to be something we'd see in mid-age at least.
I agree, it's young, but it's also common.
Yeah. That's crazy. Yeah. All right. So you talked about that family history. You saw what was happening around you.
Right.
And when you're diagnosed with things like hypertension at that age, 40 or 50 years old may have been just...
I would have probably been 300, 400 pounds. Probably. I mean, I was just out of control, and like I couldn't control my eating habits and things like that, and was too tired and felt bad to exercise, and just wasn't being what a normal 24-year-old.
You were looking at slow death is what you were looking at.
Pretty much.
What was your breaking point?
It was the point of you either can be on blood pressure medication for the rest of your life, and there's things like I couldn't wear clothes, I couldn't go, into a normal store and buy clothing, and at young you want to feel good and feel comfortable in what you're wearing and things like that.
Yeah.
So
you lost how many pounds in all?
80 so far.
80 pounds so far. And it was different this year because on Black Friday you were a shopping fool, weren't you?
I was shopping. Okay, instead of shopping for home stuff like pots and pans, I was shopping for myself, clothes and shoes and
Yeah, I'm looking at your eyes and I sense a little bit of emotion in what you just said.
Yeah. Oh, it's affects me in every aspect of my life.
Yeah.
So.
All right, Dr. Thomas. There are a lot of people out there who are kind of trying to weigh the options of whether they should have this surgery or not. There's a lot that goes into it. Let's first start with the fact that people who were told to lose weight, easier said than done, they've done everything. When they walk into your office, they can take the guilt and get rid of that because you understand what they've been through.
It's really true that first office visit is a big deal because they really have a lot of blame and feel like they haven't been successful, and it's really a challenge to make themselves make that first office visit. And I just encourage them to do it because we just talk about this stuff. But it is a really big deal because they haven't been successful. But you know what? The reason why they haven't been successful is because there's a lot of chemical pathways in our body, and their job is when we gain a certain weight to make us keep it.
Yeah.
And whether you believe that or not, you know it acts that way.
Yeah.
Yeah.
All right. There are various kinds of weight loss surgery. Which ones are available with you, and who would decide what they would have done?
See, I've been doing weight loss surgery for 13 years, about as long as anybody in Houston, and I've been doing the gastric bypass and the lap band and now the sleeve gastrectomy. And it took us a couple of years to figure out how good the sleeve gastrectomy was. But what's really good about it, it's a really good tool. These operations are nothing more than a tool to help people eat the way they need to eat. And it's a really safe tool. We're having very few problems with this operation.
We're looking at a graphic right now. It says sleeve gastrectomy. So how is the sleeve done?
So the 10 part of that operation is the part of the stomach that we actually take out. And that leaves the upper 2/3 in a tube shape. And that makes you get full on 4 to 6 ounces of food. But the magic of the operation is that we didn't realize in the beginning, but we do now because we see it every day, is that when we take out that part of the stomach, those chemicals changes. It resets everything. You actually, that drive towards food disappears in that of surgery. We think it's our psychology, but we prove it every time we do this surgery by those chemical changes by taking out that part of the stomach. You actually prefer healthy food.
Yeah, so that's, can you do that to me after the show, please? Who qualifies for one of these surgeries?
So basically, if you're struggling with your weight, you're finding it hard to tie your shoes in everyday life, you're probably going to qualify. But there are some weight qualifications, and we help you. Call our office, and we help you through that. But if you're struggling with your weight, it really is making you not feel good, and you have these medical problems, you probably qualify.
Yeah. I know a few years ago there was that struggle with insurance companies to see if they would cover this. Again, when we have that direct relation to obesity and diseases that can eventually lead to death, now it is covered by insurance?
It is covered by insurance, and I really liked it about a year or so ago on Good Morning America. The American Diabetic Association came on and said not doing weight loss surgery for a diabetic is like not doing heart surgery for somebody that needed a bypass.
Wow, because it literally can save people's lives. And as you made the point that you'll find that people almost immediately after surgery that the signs of that type 2 diabetes go away. What would you say, Katie, to somebody at home, and I have a couple of friends who are at war right now, and they know the surgery's there, it's available to them, their insurance will pay for it, but they still can't make the decision. What do you say to them to get them to make that decision?
It never hurts to go in and just talk about it. People have a hard time discussing their weight issues. I would never tell anyone that I was uncomfortable with the weight I was, but deep down inside I was. And so just become more knowledgeable about it and, think of how you could feel, and I think it is a major procedure and so on and so forth, but the downtime is minimal compared to the
compared to the
results
downtime of death. I'm just thinking.
And to the benefits you get from it. I mean, it's immediate. It's an immediate. You have control. You have more control of what you eat and how you look at food. And the first 10 pounds comes off. It's like, wow, I can move a little more at 20 pounds, and then it's just
because as Dr. Thomas mentioned, the surgery will force you to eat the way actually all of us should eat, and this is the smaller meals, smaller nutrient-dense meals throughout the day.
Right.
All right. And by the way, you are one of those people that if people come into the office that they may end up talking to.
Right.
And the nice thing about that is that you can look right at them and say, I get it, I understand. Because I still think there's a lot of shame because this is one of those things where people say, just push back from the table. It's not that easy.
It's not that easy.
I see patients, I see patients at every stage. I see them before surgery, right after surgery, 6 months after surgery, and it's a blessing. And I try to tell everyone sitting before surgery, if you could see these patients after and how they feel, and I'll get them together and talk, let them talk and just each one share their experiences, and it just makes it a lot easier. And it makes it a lot easier for patients to say, hey, I've been there. I've been nervous about surgery. I mean, it's normal. It's human nature. So.
And now you are showing up and showing out.
I'm working on it, girl.
All right. Thank you very much, Katie. Thank you, Doctor. For more information about the sleeve gastrectomy surgery or for more on Dr. Thomas, you can call his office at 713-936-0777, 713-936-0777, or visit his website at cliftonthomasmd.com.